Jeff, good to see you again. How are you doing?
I'm doing better.
Better. We talked about that the first time I saw you. Define for me what you mean by better.
Well, a lot better than when this first happened, but still a little bit better than even the last time that I saw you.
Oh, that's good. How about those medicines we gave you? Are you still taking them every day?
No more pills for me.
Oh, how about the therapy that we taught you? Are you still doing that?
Yeah, actually, when I do the therapy, I feel great. If I let it fall off a little bit, I can definitely start to feel things coming back.
That's very typical, Jeff. So that's work. How about home? How are you functioning at home?
Home's really great as well. I am able to pick up my daughter with no pain now, and even last week I was able to mow the lawn.
Oh, those are all good signs, Jeff. So now we've talked to Jeff again about a very important point, how he's doing. How he's doing relative to when he first got hurt or his last visit. He defines both. It's important in your note to document that. And as importantly now, you've shown empathy. I care about what's happened to Jeff at work. Certainly, this is work compensable. But I also care what's going on with Jeff at home, his daughter, cutting the grass. These are important aspects of his life that impact his health care. Jeff, I've gotten your MRI and your X-ray results, and I've looked at the studies myself. Would you like to look at them? Do you have time today to look at them?
Sure, yeah, I've never been asked to look at them before.
Well, I think it'll help you understand a little bit of what I'm going to tell you next, okay? Let's look at them. So now, something that's happened to Jeff for the first time in 35 years, we've included him in his health care. He'll probably look at the MRI and X-rays and not understand a lot of what you're going to tell him, but nevertheless, he feels part of the active healthcare team. He is part of this team. So now you see, Jeff, and I think you understand a little bit. We talked a long time ago. Your MRI and your X-ray show things that are more explainable by being 35 or 40 years of age, not something that happened lifting a box at work 2 months ago. So if you want to investigate that further, we sure can. However, I have to tell you, if that was me and you're doing so much better, I don't think I'd look into it at all. I'd keep doing what you're doing, and I think you'll get better still. So every patient's a little different, but it's important for Jeff to understand how credible we really are, how strong our opinions are. We've told Jeff what we would do if this were me. We told Jeff what we would do if this were our best friend. It's important for Jeff to have that kind of strength of reliance in our information to proceed further and follow our instructions. So now you understand what we're going to do at this point. I want you to stay at work. Will you do that?
Sure.
I'm going to release you to full work so you and your boss figure out what you can and can't do on a regular daily basis if need be. You'll talk to him about that?
I will, yes.
And stay off the medications. You don't need those anymore.
Done.
And I want to see you again in about 3 or 4 weeks for one final visit. Come back one more time.
Sounds great.
See you then.
Thank you.
So in this visit, we've loosened the restrictions. We've allowed him and his employer to establish any accommodations which might be needed for full employment. And we've set the goal line for one final visit. Thanks for watching. We'll see you next time.